Okay, today's plan of attack, we're going through units 2 and 3. Unit 2 here is we're going to be talking about movements, which are huge when we get to the muscle units. And then unit 3 will be our first bone unit. And we're going to be looking at the skull. I'll talk a little bit more about that when we get there. Let's start here. Arthrology and movements. Arthrology means the study of movement. So that's all that fancy term means. In order for us to move, though, we've got to have joints. And what joints are where two bones come together. That's what a joint is going to be. Now, we've got 3 major classifications of those joints. First is synovial joints. And these joints are classified as those joints that do not move. There's no movement that occurs here. Some are sutures. If you think about, if you ever had stitches or whatnot, sutures are joints where they are connected, okay, by hard tissue there, fibrocartilage tissue, and those don't move at all. And you'll see them like in your skull, because when you're a little baby, your skull bones are apart, which allows the baby to get through the birth canal. But over time, these will come together and form a suture joint. So while a lot of times we might think of the skull as basically one bone, it's actually made up of a bunch of smaller bones. And we'll talk about that a little bit more in Unit 3. Another kind of joint, though, we have are a synchondrosis joint. Now, before we move on, talking about synchondrosis joints, if you ever see in your lab manual, parentheses, that's probably referring to either the singular or the plural form. So if we're talking about one synchondrosis joint, we use IS for the ending. If we're talking plural, we'll replace IS with ES. But a synchondrosis joint, think of those as growth plates. Again, growth plates are at the end of long bones, and when you're growing, they're really far apart. Now, obviously, when we get to adults, they're closed up together. The synchondrosis joints, like sutures, are synovial. That means there's no movement that occurs there. However, we do need some joints that have a little bit of movement, and we call those anti-arthrodial joints. So these have slight movement that occur there. One example of that are symphysis, or symphyses, if we're talking plural. An example of a symphysis joint is you've got your intervertebral discs in your spine, and those allow for a little bit of movement to occur. I mean, if they didn't, we'd be walking around like robots here. That would not be comfortable at all. Our spine has to be able to bend a little bit, and that's what these fibrocartilage tissues allow you to do. You'll also find those between your 2 pelvic bones. Okay, we call that the symphysis, pubic symphysis. And that we'll talk a little bit later on in the semester. We also have those syndesmosis joints. And those happen at the end of your long bones. Okay, specifically in your forearm and in your lower leg, your shank. But these 2 joints here, okay, they allow for a little bit of movement. And for example here, this is in your ankle. There has to be a little bit of twisting that goes on between your tibia and your fibula when you're moving around. Okay, so a little bit of rotation happens, but we need this here so that your tibia and fibula don't fly apart. So anti-arthrodial joints, these 2, there's slight movement that occurs there. Diarthrodial, these are the joints that are freely movable. They can move around a lot. Because they move around a lot, they need some sort of lubrication that happens. So that's where synovial fluid is secreted into these joints to allow the joint to move well without a lot of friction happening. And oftentimes with these joints here, there's a number of different planes of movement that these joints can occur in. And we'll talk a little bit about that when we get there. But to start here, gliding joints. You'll find those in your wrists, or you'll find those between 2 facets of your vertebrae. Likewise, okay, a pivot joint, okay, has one axis of rotation. Okay, so that means pivot joint can move in one plane. Next to condyloid and saddle joint. Condyloid and saddle. These both are biaxial joints. Biaxial means there's two axes of rotation. That means these joints can move in two different planes. Now it gets a little confusing, the difference between these two, and I'm not going to exactly quiz you on that, but essentially it has to do in terms of concave and convex, the way the bones are shaped. A condyloid joint means you got one bone, okay, is convex, the other is concave. And they're convex and concave in the same direction. And the way I like to think about it is if you're going down a water slide, okay? So you got concave, yourself as the body is convex, okay? You're going the same direction. And you can see those happen in your more proximal knuckles, because my knuckles, my fingers can go like this, and they can go like this. And all that movement's occurring at those proximal knuckles there. So if I'm doing this motion here, this is happening in the sagittal plane. But this is happening in the frontal plane. Essentially going like this is the axis of rotation. When I'm going apart, the axis of rotation is going this way. So that's a condyloid joint. Okay. Two axes of rotation, so biaxial, two planes of movement. Saddle joint, okay, that's where we have a convex and a concave surface, but they go in opposite directions. And the way I like to think about it is if you got a skateboarder going down a half pipe. Okay. So unlike on the body slide, concave, convex in the same direction, skateboarder in the half pipe is going the opposite direction. And as far as I know, there are only two saddle joints in the human body. One is basically your thumb right here. Another one would be in your ear. Ear bones, we won't talk about that this semester. But both of them are the same. Both are biaxial, which means they have movements in two different planes. Condyloid and saddle. Lastly, we got ball and socket. Common ones we think about is your shoulder and your hip. And this might help to make a little bit more sense. So here's an upper arm bone, okay, your humerus specifically, and because you got a ball here, okay, it goes into a socket. And it allows your shoulder to go all different directions. Because my shoulder can go frontal plane movement, it can go sagittal, and it can go transverse. So, ball and socket joint has three different planes of movement. It can move in any plane it wants, all different directions. Now, a couple points that we'll talk about later in the semester. The ankle is not a ball and socket joint. One, if you notice, you don't really see a ball-shaped bone there. But also, there are actually two different joints that allow the ankle to move in all the different directions that it can. Additionally, your knee, you would think, between your femur and your tibia, would be a hinge joint, but it's technically not a hinge joint. It really is a condyloid joint. And that's because your shin, okay, or your tibia, can actually twist a little bit. So not only can your knee flex and extend, it can also twist a little bit. And again, we'll talk about that later this semester. This slide on PowerPoint, feel free to use this. It just kind of summarizes all the different information that we talked about. So with your table mates there, go through those three questions If you have questions, let me know as you're trying to answer those. Okay. All right, first one there. One plane of movement, okay, and allows bending to happen. That would be a hinge joint. Number two, amphiarthrodial allows for a little bit of movement. Remember, synarthrodial, no movement. Diarthrodial, a lot of movement. Condyloid joint has two axes of rotation, which means it has two different planes of movement. Movements of the body. And I think the easiest way to do this is if I demonstrate it myself. But a couple things. One, this video, while it's extra cheddar cheesy, does a really good job of explaining most of the movements. It doesn't go through horizontal abduction and adduction, and it doesn't go through circumduction, but good resource. Additionally, if you have trouble connecting the movements with the planes that they occur in, this webpage might be useful for you. All right, okay. Flexion talks about decreasing the joint angle. And for example here, bicep curls. Okay. Flexion, decreasing the joint angle. Shoulder flexion, okay, would be coming up like you're raising your arm above your head. Hip flexion, okay, knee coming up like this. So flexion there, decreasing the joint angle. And an easy way to, no, never mind, pause on that thought. Okay. Extension is going to be the opposite way. So if I'm doing a push-up, okay, I'm extending my elbow, increasing that joint angle. Okay. Tricep push down, extending it there. If I'm doing a back extension, okay, I'm coming up like this. Extension, increasing the joint angle. And once you write this down, the easiest way I understand flexion and extension is if I'm standing in the anatomical position, what direction is my movement occurring in? So anything in the axial skeleton, so we're talking our head, neck, trunk, extension is going to be coming up, flexion is going down. Okay. So back extension, neck extension. So that would be extension movement versus flexion is going to be going down, bringing my chin to my chest. That's neck flexion. Doing a crunch, trunk flexion. Now that's the opposite when you talk about your arms and your legs, your appendicular skeleton. Bicep curl is elbow flexion. Raising my arm above my head here, this would be shoulder flexion. Okay. Bringing my knee up, that would be hip flexion. Versus pressing down would be elbow extension. So appendicular skeleton, extension down, flexion up. Opposite for your axial skeleton. Now with all those movements here, okay, so if I'm doing my knee here, knee flexion, knee extension, what plane does this movement occur in? Knee flexion, knee extension. Sagittal. Hip flexion, hip extension. Sagittal plane. So flexion and extension movements, write it down, would be in the sagittal plane. Next to abduction and adduction. This refers to the midline of your body. So if I kick my leg out to the side, that would be abduction, going away from the midline. Kind of like you're getting abducted by aliens. Independence Day, baby. Will Smith killed it in that movie.
That was a fire movie.
That was so insane. Okay, so abduction, being abducted, taken away, going away from the midline. Versus adduction, adduction, adding into the midline. Okay. adding into the midline of my body. So this would be hip abduction, abduction, hip adduction. This would be shoulder abduction, shoulder adduction, abduction, adduction. And these movements occur in the frontal plane. Next two, abduction and adduction, but horizontal. Okay. So think of it, you're looking at a bird's eye view of this. Okay. So horizontal abduction, abduction going away would be like doing a reverse fly. Okay. So I'm coming here, this would be horizontal abduction if you're looking from the top down. So opening my arms up to give a hug, horizontal abduction. Adduction would be bringing your hands together like those monkeys with the cymbals. Horizontal adduction, adding in. And we talked about here, and was on your quiz there, this is a transverse plane movement. Horizontal AB and adduction, transverse plane. Internal, external rotation. Now, notice the words talking, the rotating the axis of the bone away from the body for external or into the body for internal. So here's your bone, okay, my shoulder bone, or my upper arm bone. Axis of rotation. Okay, so what's happening here is if I move my arm in, twisting in, okay, my arm bone humerus is twisting in. This would be internal rotation. Right. So if I'm doing this movement, start here, finish here. This would be internal rotation. Start, finish. Versus external, twisting away. So coming here, twisting away. This would be external rotation. Start, finish. Internal, external rotation, we're looking at a transverse plane. Again, because it's a twisting movement. Now the next four refer to your ankle. Why the ankle is so special, I don't know. Okay. But eversion, okay, sole of your foot points away. Okay. So start, finish. Sole, bottom of my foot, pointing away. Eversion starts with the letter E, like you're exiting the building. Exit. Versus inversion, sole of your foot points in towards the midline. Eversion, exit, away. Inversion, towards the midline. Inversion, and eversion, that's talking a frontal plane movement. Dorsiflexion, okay, toe coming up closer to the shin. Plantar flexion, okay, going down into the ground. Remember we talked last week, plantar region is the bottom of your foot. So plantar flexion is pushing your foot into the ground. Versus dorsiflexion, dorsi meaning dorsal. Look how my ankle looks like a shark's fin. That's going to be dorsiflexion. Plantar flexion, dorsiflexion. And again, these movements occur in the sagittal plane. Dorsiflexion, plantar flexion. Supination and pronation, they occur at the elbow. Supination, twisting, and your palm would be up, kind of like you're holding a bowl of soup. Bowl of soup, supination. Pronation, palms down. Palm down, letter P, pronation. Another way to look at it, remember supine talked about laying on your spine, laying down. Okay? If my hand is like my body, the bony part of my hand, okay, that's like my spine, okay? So when I'm supination, spine down, okay, that's when my palm is up, versus pronation, okay, the fleshier side, kind of like your belly side, okay, palm down there. Palm up, supination, palm down, pronation. And again, if we're standing in the anatomical position, this is what it looks like, supination, pronation. So this occurs in the transverse plane. Lastly, circumduction. We're thinking circle. So whether you're doing the stanky leg or you're doing a softball pitch, okay, that's circumduction. While your arms or your legs, you're making a circle. All right, real quickly here. 4 questions. Try to answer those with your partner. Number 1 there, dorsiplantar flexion in your foot. That's going to be the sagittal plane. So, anatomical position. Okay. So if I go elbow extension, that's going down. So appendicular skeleton, referring to your arms and legs, extension is going down. Versus extension, okay, with your trunk. Okay? Extension, that's going to be going up. Axial skeleton, extension is going up. Ankle eversion. Okay. Bottom of your foot points away from the midline. Okay. Eversion, letter E, exiting. And then here, left to right, we got internal rotation. And that would be a transverse plane. Okay, unit 3 here, talking about the skull. This is our first bone unit. Now next week on your quiz, you will have a skull at your table and it will have a number of orange stickers on it. And the number refers to either a bone of the skull or the landmark on the skull. Well, a landmark is just a special part of the skull that sticks out from a bone. So make sure next week, when you look at the question, make sure you know whether it's asking for a bone or a landmark, because it can get kind of confusing, maybe what the number is referring to. In addition, when it'll say something like name the bone or name the landmark, you will have to write that out. So spelling will count for that. And I think it's roughly, we got anywhere between 6 to 10 landmarks out of the 20 questions next week. Will be either landmarks or bones of the skull. So again, make sure we know how to spell. Start with bones of the skull. Okay. We've got quite a few of them. Starting in the front, okay, big old forehead bone, that's our frontal bone. Forehead, letter F, frontal bone. Now as you're going along here, feel free to look at the actual skull you have at your table. Feel free to open up the atlas and open up to different pictures. Feel free to use those resources here. You can also just look up here as well. Feel free to mix and match. Frontal bone in front. Parietal, okay, that's up and back here. If I was a bear, that'd be where my ears would be at. Parietal bones up there. And then coming all the way down to the back bottom, that's going to be the occipital bone. And then directly on the side, we call these our temporal bones. Temporal, thinking temples. So if I'm Muhammad Ali and I knock some sucker out, a lot of times it's because they get hit in the temple, in the side of their head. So we call that the temporal bone. A couple other bones, we got the sphenoid bone. It's in purple on this one, but over here it's in yellow. And I like to refer to this as the butterfly bone. This is a view if we cut off the top of the skull. So that's the sphenoid bone, I like to call it the butterfly bone. And then directly in front, okay, directly anterior to the sphenoid bone is the ethmoid bone. Ethmoid there. You can kind of see it here, but it's a little better view here. And when I show you the video, it's going to give you a better idea of what that bone looks like. All of these bones are considered bones of the cranium. Cranium here. Now, facial bones, we also got several of these. Starting at the top, okay, the bridge of your nose, not down here, where we got all that cartilage. Up top here, we got two nasal bones. Directly on top of your nose there. In light blue here, these are our lacrimal bones. And I think on your skulls, it's where the tear duct is located. This bone is immediately anterior to the ethmoid bone. So we had our sphenoid bone, our ethmoid bone, and immediately anterior to that, that's going to be our lacrimal bones. In yellow, our upper jaw, we call that our maxilla bones. We've got two of those. Bottom jaw, we consider that our mandible. So you got one bottom jaw there. Zygomatic, in green, those are like your cheekbones. Right here, that pointy part. Zygomatic are your cheekbones. If you look directly into the nose, you'll see a fin sticking up. Vomer bone. That's considered our vomer. And vomer is another term for plow. So if you're thinking back in the 1800s when you got your donkey, you're tilling the fields, you got the big old blade in the ground trying to loosen up the dirt, that's where vomer came from. Vomer refers to plow. And lastly, if you open your jaw, okay, in the back on the roof of your mouth, those are our palatine bones, okay, or palates. Any food or wine enthusiasts in here? Something about a palate, I'm not sure what that's all about, but tasty stuff, palatine refers to your palate. Okay, back here, got two of those bones.
So that was a roof in your mouth?
Yeah, right back there. Now, I mean, 2D representation is okay, but I have a late 3D representation, and I think this video does a better job of showing just how many different bones we have in our skull there. Yellow, that's our butterfly bone, our sphenoid bone. There's our ethmoid in purple. And this video, I mean, goes for about 3 minutes, but feel free to use this if you want to get a better visual of what these bones look like and how they're all put together. It's pretty snazzy, and I want to know the guy who came up with the computer generation graphics, how they did this. I don't know how you do that. It's just phenomenal. But again, feel free to use that if you want to kind of get a better 3D view of what a skull looks like and all the bones together. Now we talked about sutures. Remember, sutures are joints that come together and are immovable. We've got a number of sutures on the skull, but we're only going to focus on 4 of them. First one is the coronal suture. Remember the frontal or coronal plane. Okay, cuts our body in half. Coronal means crown. Coronal crown. And that's between the frontal and the parietal bones. A student in the fall, okay, a couple students came up with the corona, okay, coronal suture. Coronal, corona is the king of beers. Well done. Coronal suture, okay, crown. Sagittal suture, dividing the parietal bones in two, lies in the same direction as the sagittal plane. So sagittal between your two parietal bones. Lambdoidal suture. It's an upside down V, and that comes from the Greek letter lambda. So the Greek letter lambda is upside down V. So that's where the name of the lambdoidal suture came from. And that's between the parietal and the occipital bone. And finally, between our parietal and our temporal bones, we got a squamous suture. Squamous, letter S, is on the side of your skull. So using this, okay, feel free to use this as a picture, and then feel free to use the skull you have in front of you. Find what are all the bones that refer to C, F, G, J, and L. All right. So letter C here, that's going to be your nasal bone. F is going to be your mandible. G all the way to the top here, pointing to the suture. It's going to be your coronal suture. J, okay, pointing to your squamous suture. And then L, just below that squamous suture, is your temporal bone. So basically, this is a big chunk of your quiz next week. You'll be given your skull, but instead of a diagram, I won't ever use that diagram on the quiz. It'll be like the number 1 stuck right there. And the question will say, name that bone. So that's kind of what next week will look like. Now the next few slides here, they're pretty much for your own benefit. There's just so many different words on it and whatnot. Feel free to use that. But what I'm going to do for most of the landmarks on your skull, I'm going to use the actual skull and I'm going to point them out. However, this one I want to point out directly on this picture because the colors make it pop a little bit more. And so we're going to skip to the end to start, and then we're going to go back through some of the other landmarks. So this is your sphenoid bone. And this is basically chop off the skull looking from the top down. Now, we call this a butterfly bone because it looks like a butterfly. And on a butterfly, we got to have wings. In red here, these are the greater wings of your sphenoid bone. Up top here, poking out a little bit in green, those are your lesser wings. Listen.
Thank you.
This right here and here, that's going to be your optic canal, or you could write down optic foramen. Doesn't matter to me which one. But this is where your optic nerve passes through to get to your eyeball. Remember, foramen means hole. Optic foramen or optic canal. Either way. And lastly, in the middle here, you kind of got a saddle. Okay? And we call that the sella turcica. And that's where your pituitary gland sits. Sella turcica right there. Alright, boom, you got our skull here. If you at all have trouble seeing something, please let me know. But boom, chop off the top of his head. Right in the middle here. Alright, so let's talk about that sphenoid bone. Take a look at your own skull. But you'll notice we got sutures right here. And they come down here. So up top here, these are your lesser wings. of your sphenoid bone. Down here, that's your greater wing. In the middle, you got your saddle, sella turcica. And then we got our two holes, optic foramen or the optic canal, whichever one you want to talk about. Moving back up to the top. So we should all be on letter A with the frontal bone for landmarks. Now the nice thing is a lot of these landmarks, the name gives it away. And we talk about a lot of things we talked about last week. So the first one, supraorbital foramen. We know foramen means hole. So we're looking for a hole. Orbital means eye socket. So you got eye socket here. And supra means above. So literally mean above hole of the eye socket. So right there and right there. Those two are your supraorbital foramen. Next one, temporal bone. Mandibular fossa. Mandibular fossa. Mandibular meaning mandible. And fossa refers to a shallow concave surface. And what that is where your mandible articulates with the temporal bone. So right here, that's where your mandible pivots. Inside there, that's your mandibular fossa. Just notice how my jaw is going there. Right there, that's going to be your mandibular fossa. Take it one more time. Mandibular fossa. External acoustic meatus. External, meaning on the outside. Acoustic, meaning hearing. Meatus, thinking back to last week, means the entrance to a tunnel. So external ear tunnel. Talking right here. That's the entrance inside of your ear. External acoustic meatus. And again, since this is a plastic bone, it doesn't go all the way through. But a normal skull, that tunnel will keep on going. Styloid process. Styloid, thinking stylus like a pen. Process meaning something that sticks out. On the bottom here, this pointy part, you consider that styloid process. Mastoid process. Mastoid, thinking mastodon, big old woolly mammoth, big old elephant. Talking right there. Kind of looks like a baby tusk. Styloid process and mastoid process. Now the next two, the wording's kind of confusing. And when I looked it up online, the wording doesn't seem to match up what the other resources I was looking at. But essentially, what this is going to be the zygomatic arch. I'm not going to test you on these two. But this entire thing is the zygomatic arch. And if you'll notice here, we got a suture right here between your zygomatic bone and your temporal bone. So technically, the zygomatic process is this. It's the zygomatic process of the temporal bone. It's this part that juts out. And then this part technically would be the temporal process of your zygomatic bone. Again, if your head is spinning, it's because my head was spinning trying to figure this all out. So I won't quiz you on those two parts, but just so you have an understanding of what that's talking about. Go to the bottom of your skull. Foramen magnum. Foramen means whole, magnum means large. Right there, where your spinal cord passes through. So that's going to be your foramen magnum. Occipital condyles. Condyles, remember parts that protrude from the end of a bone. Occipital meaning on the occipital bone. And that's going to be these two things right here. These are your occipital condyles. And these are the parts of your skull that sit on your top vertebrae. In the back here, external occipital protuberance. External on the outside, on the occipital bone. Protuberance, they can protrude. So this part right here. And it's hard to see visually, but I think feeling it makes a little bit more sense. If you take your hand, put it on the back of your skull, and find that pointy part right back there. That's your external occipital protuberance. Moving on to our bottom jaw, our mandible. The mandible is one long piece. We've got an angle of the mandible on each side. An angle is where a bone changes directions. So right here we can consider the angle of our mandible. Now if I take my jaw off, these are kind of like two arms here. Here and here. They're like arms. So if we have arms, we must have a body. So this part is the body of our mandible. So we've got body, angle, and then we've got ramus. Additionally, you've got two foramen here. These are considered your mental foramen. Holes in the bottom of your jaw. Lastly, we've got our infraorbital foramen on our maxilla. Infra meaning below, orbital meaning eye socket, foramen. So right there and right there. Essentially, the supraorbital foramen, infraorbital foramen, mental foramen, they're basically holes around blood vessels to pass through so that your skull gets the blood that it needs to function. All right, let's find these three landmarks. Not bones, landmarks. E, F, and G. Take a minute to do that. All right, letter E, external occipital protuberance. We got foramen magnum, and we got occipital condyles.